All right, everybody, Dr. Garrett Weegriff here at Pure Plastic Surgery in Miami, Florida, coming to you for Thursday Thoughts. Today we are going to be discussing gynecomastia. So we have men that lose a bunch of weight and they come to me and they say, why do I still have man boobs? So there's a few things that could be going on. The first thing we need to do is figure out what's going on. So people that have weight loss, they often have some loose skin. They can have what's called pseudogynecomastia, where it's just residual fat overlying the pecs. True gynecomastia is where you have actual breast tissue that is hypertrophied for some reason related to your hormones. This can be due to a few different reasons, so we really have to get this worked up. You have to see your primary care doctor. We have to look at your hormone levels, make sure there's nothing concerning, the potential of cancer or something like that. But the most common reason for men to have true gynecomastia, which is true hypertrophy of breast tissue, is typically anabolic steroids or even TRT or hormone replacement in this day and age. A lot of people are doing hormone replacement and TRT, and so that's a reason to develop some of this breast tissue that you want to otherwise have. Also, young men going through puberty or just with raging testosterone from being a young, healthy guy at 16, 17, 18 years old, it's possible to have it just from those natural hormonal changes. That's typically limited and it returns to normal after your hormone levels stabilize. So for those guys, we just observe it for a few years. But if you're older, you have this ongoing issue, especially if you are doing TRT or something. And there's additional drugs that you sometimes have to take to limit that as a side effect. Surgery eliminates the breast tissue and it eliminates the need for you to continue taking additional drugs to combat that side effect of your hormone replacement therapy or TRT. So we're talking about the true gynecomastia right now. What do we have to do to treat that? We have a few different options. Depending on if you don't have too much loose skin and we just feel that thick glandular tissue and it's giving you a puffy looking nipple, we can go in with two modalities. We'll treat it with Vaser, which is the ultrasound powered liposuction tool that we use, and then traditional power assisted liposuction to break it all up. But then we typically still have to make a small incision around the border of the areola to go in there and carefully remove some of that thick glandular tissue because it doesn't always come out completely with liposuction. So for the guys out there that are just a little bit overweight, you have fatty breast tissue underneath your nipples, that can sometimes be treated completely with liposuction and Vaser with no need to make a larger incision to do a direct gland excision. And so it really depends on what we see when we examine you and what I feel when I'm doing the examination underneath the nipple. Then we have the extreme, so people that have come in with massive weight loss or lost just a significant amount of weight from either these GLP-1 medications, surgical weight loss, or just hardcore diet and exercise. And if you come in with hanging breast tissue, we're going to need to do some type of skin removal surgery to tighten that up. Sometimes it's as small as doing a little periareolar reduction where we're making a donut reduction around the nipple. It's pretty uncommon. If you really have a lot of loose skin, we often have to do what's called a double incision procedure where we're actually taking off the nipple and doing a free nipple graft after we remove all that skin. So this is much different than what we do for like a breast lift for a woman, where we have the anchor incision that goes around the areola down vertically and in the fold of the breast. This is all going to be contained to just one straight masculine looking incision on the bottom of the pec muscle. And then we're actually going to take your nipple and graft it back into a proper anatomic location to really give you the nice contoured chest that you want for a man. We can also at the same time do things like fat grafting to the upper part of the pec to give you more of a full masculine looking chest at that time. So we have a bunch of options for you. We do need to do a little bit of workup to make sure you don't have some underlying hormonal issue going on. But it's a very powerful surgery for taking care of this issue that you just can't get rid of in the gym alone. So please come check us out at pureplasticsurgery.com and we can help you address gynecomastia. We can do other procedures at the same time like liposuction and really get you that summer body you're looking for.
Thank you. So we have a few questions that were sent in.
All right.
Let's. The first one is, so after it's removed, is there a possibility they can come back?
Typically, no. We always have to leave a very small amount of the glandular breast tissue directly underneath the nipple, or you get a very scooped out looking look of the nipple, and so it's important to leave a certain amount. That can possibly hypertrophy a little bit, but typically it's a non-issue after it's removed, and you don't have to worry about that anymore.
Okay. And for the patients who do not want general, can this be done awake?
I do not do it awake because I think it's oftentimes a little painful, a little bit more invasive than what some people would think. And sometimes, after we do the liposuction, if we're not getting the result we want, I'll consent you to go do the direct excision at the same time, and you don't want to do all that under local.
Okay, so what is this tissue? Is it potentially harmful? Is it cancerous?
No, it's not harmful, it's not cancerous, but it is actually stromal breast tissue, that same thing that women can have. Even though our nipples are pretty useless as men, we do have a little bit of breast tissue that's in there, and it's just the hormonal reaction to those signals is to grow in hypertrophy, and that's what we're getting rid of.
All right, last question. Could this potentially leave you with loose skin?
So yeah, that's one of the things that we're gonna assess at the beginning. If I'm confident you're gonna have loose skin, we're gonna go right to one of those skin excision procedures. If you're borderline, sometimes we do the liposuction first. We wear a nice compression garment. You're gonna have to wear a compression vest for the next few weeks after surgery. And everything tightens up with the liposuction and direct excision alone. We don't need to do any skin excision, but sometimes we stage that to avoid extra scars that may be unnecessary.
Thank you very much.
All right, everybody, have a great day. See you next week for Thursday Thoughts.